Medicare is a federal health insurance program designed primarily for people age 65 and older, providing essential coverage as they enter retirement. It also serves certain younger individuals who have qualifying disabilities or specific medical conditions, such as end-stage renal disease. Medicare helps pay for a wide range of healthcare needs, including hospital stays, doctor visits, preventive services, and prescription drugs, making it a vital resource for millions. As you approach retirement age, understanding how Medicare works becomes crucial for your long-term healthcare planning and peace of mind. The program is divided into different parts, A, B, C, and D, each one covering specific types of services, from hospital care to outpatient visits and prescription medications. You have the option to choose between Original Medicare, which is managed by the government, or a private Medicare Advantage plan that may offer extra benefits. In addition, private insurance companies offer supplemental policies, known as Medigap, and standalone prescription drug plans to help cover costs that Medicare doesn't pay. The choices you make can significantly impact your out-of-pocket costs, the doctors you can see, and the quality of care you receive, so it's important to carefully compare your options. While Medicare is managed by the Centers for Medicare and Medicaid Services, private insurers play a major role in offering additional plans and coverage options. The right Medicare coverage for you depends on your unique health needs, financial situation, and personal preferences for care. Remember, the decisions you make when you first enroll can have lasting effects, so taking the time to research and understand your options is essential. This guide will break down the essentials of Medicare, explain your choices, and provide tips to help you make informed decisions for your future. By the end, you'll have a clear understanding of how Medicare works, what steps to take next, and how to get the most out of your coverage. Most people qualify for Medicare at age 65 if they're U.S. citizens or legal residents for at least 5 years. Eligibility for premium-free Part A depends on your work history. Typically, you or your spouse must have paid Medicare taxes for at least 10 years. Younger individuals with certain disabilities also qualify after receiving Social Security disability insurance for 24 months. Two conditions, end-stage renal disease and ALS, grant immediate eligibility, regardless of age. If you don't meet the work requirement, you can still buy Part A by paying a premium. Most people qualify for premium-free Part A based on work history. Part B, C, and D are available to anyone eligible for Part A. To join a Medicare Advantage Part C plan, you must have both Part A and Part B. These rules ensure access to coverage for those who need it most. Understanding your eligibility helps you plan your enrollment and coverage. Medicare Part A is known as hospital insurance, and it's a key part of your Medicare coverage. It helps pay for inpatient care in hospitals as well as care in skilled nursing facilities when you need it most. Part A covers important services like semi-private rooms, daily meals, nursing care, and necessary medications during your hospital stay. However, you'll still be responsible for paying a deductible for each benefit period, which is the amount you pay before Medicare starts to pay. For longer hospital stays, you'll also pay coinsurance, which is a share of the costs that can add up over time. Skilled nursing facility care is included after a qualifying hospital stay, but it's only for short-term rehabilitation, not for long-term or custodial care needs. Medicare pays the full cost for the first 20 days in a skilled nursing facility, so you won't have to worry about coinsurance right away. After those 20 days, you'll pay a daily coinsurance amount for up to 100 days in each benefit period. Part A also helps cover some home health services and hospice care, providing support for those who qualify and need care at home or at the end of life. Hospice care, under Part A, focuses on comfort and quality of life for terminally ill patients, and with most costs fully covered by Medicare. Most people get Part A premium free if they or their spouse paid Medicare taxes for at least 10 years while working. If you don't qualify for premium-free Part A, you can still buy it by paying a monthly premium, so coverage is available to more people. Even with premium-free Part A, remember, you'll still have out-of-pocket costs like deductibles, coinsurance, and sometimes other fees. Understanding these details can help you better plan for your hospital-related expenses and avoid surprises when you need care. Medicare Part B covers outpatient care, doctor visits, preventive services, lab tests, and more. It pays for checkups, screenings, ambulance services, durable medical equipment, and mental health care. Preventive care is a big focus, including annual wellness visits and important vaccinations. Part B is optional but highly recommended. Delaying enrollment can mean a permanent late penalty. Most people pay a standard monthly premium, which may be higher for those with higher incomes. There's also an annual deductible, and after meeting it, you typically pay 20% coinsurance for covered services. There's no annual out-of-pocket cap, so costs can add up if you need a lot of care. Many people buy supplemental insurance to help cover these expenses. Understanding Part B helps you plan for routine and unexpected medical costs. Make sure to enroll on time to avoid penalties and gaps in coverage. Review your needs each year to ensure your coverage still fits. Medicare Part D is designed to help cover the often high costs of prescription drugs, making essential medications more affordable for seniors and those with disabilities. This coverage is offered by private insurance companies that are approved and regulated by Medicare, ensuring a range of plan options to fit different needs. You can enroll in Part D through a standalone prescription drug plan, which works alongside original Medicare to provide drug coverage, or you may choose a Medicare Advantage plan that includes prescription drug coverage, combining medical and drug benefits in one plan. Part D is optional, but if you delay enrolling without having other credible drug coverage, you could face a late enrollment penalty that increases your costs. Each plan has its own list of covered drugs called a formulary, which is organized into cost tiers. Lower tier drugs, often generics, cost less, while higher tier or brand name drugs may cost more. It's important to carefully review a plan's formulary before enrolling to make sure your medications are included and affordable. You should also check your plan every year during open enrollment, as formularies and costs can change annually. Costs for Part D plans typically include a monthly premium, a possible annual deductible, and co-payments or co-insurance for each prescription you fill. Most plans have preferred pharmacy networks, which can help you save money by offering lower co-pays at certain pharmacies. Part D coverage is divided into phases. Initial coverage, the coverage gap, often called the donut hole, and catastrophic coverage, where your out-of-pocket costs drop significantly after you reach a certain spending limit. If your prescription drug costs are especially high during the year, catastrophic coverage will help protect you by capping your out-of-pocket expenses for the rest of the year. Taking the time to compare and choose the right Part D plan can lead to significant savings and give you peace of mind knowing your medications are covered when you need them most. Original Medicare is the traditional government-managed plan made up of Part A and Part B. You can see any doctor or hospital in the U.S. that accepts Medicare, no referrals needed. While it covers many services, there are gaps like deductibles and 20% coinsurance with no annual out-of-pocket limit. And many people buy Medigap policies from private insurers to help cover these costs. Medigap plans are standardized, but premiums vary by company. Original Medicare doesn't cover most prescription drugs, so you'll need a separate Part D plan. A complete package often means Part A, Part B, Part D, and a Medigap policy. This path offers flexibility, but requires managing multiple plans and premiums. Medicare Advantage, Part C, is a private alternative to original Medicare, bundling Part A, Part B, and often Part D into one plan. These plans may offer extra benefits like dental, vision, hearing, and fitness programs. Most are HMOs or PPOs with network restrictions and possible need for referrals. You'll pay fixed co-payments instead of 20% coinsurance, and each plan has an annual out-of-pocket maximum. Some plans have low or $0 premiums, but you still pay your Part B premium. Extra benefits and costs vary by plan and location. Medicare Advantage simplifies coverage, but may limit provider choice. Compare networks, costs, and benefits to find the right fit for you. Medicare costs depend on your coverage choices, income, and healthcare needs. Part A is usually premium-free, but you'll pay deductibles and coinsurance for hospital stays. Part B has a monthly premium, which is higher for those with higher incomes, plus an annual deductible and 20% coinsurance. Medigap policies add a separate premium but help cover out-of-pocket costs. Part D and Medicare. Advantage plans have their own premiums, co-payments, and deductibles. Medicare Advantage plans cap your annual out-of-pocket costs, unlike original Medicare. Always compare total costs, including premiums, deductibles, and co-pays, when choosing a plan. Use the Medicare Plan Finder to estimate your annual costs and find the best plan for your needs. Choosing Medicare coverage is a major decision that shapes your health care and finances. The main options are original Medicare, often with Medigap and Part D, or an all-in-one Medicare Advantage plan. Original Medicare offers broad provider choice but leaves gaps in coverage and costs. Medicare Advantage bundles coverage, adds extra benefits, and caps out-of-pocket costs, but limits provider networks. Consider your health, budget, travel, and doctor preferences. Use resources like the Medicare website and SHIP counselors for guidance. Review your options during your initial enrollment period and each year during open enrollment. Informed choices give you security and peace of mind for your healthcare future.